Good morning, students. In this session, we will see the part 3 multiple choice question and their answers. A woman is admitted with a severe preeclampsia. What type of room should select for this woman? A room next to the lift, the labor suite, the room well ventilated and far from the nursing station, and quiet room in the floor. The correct answer is the quiet room in the floor, because any extraneous stimuli that will stimulate eclampsia. A new mother is breastfeeding her baby. What is the best indication that the letdown reflex has been achieved in a nursing mother? Increased prolactin level, milk dripping from the opposite breast, progressive weight gain in the baby, relief of breast engorgement. The correct answer is milk dripping from the opposite breast. The third question, the nurse is caring for a woman in the first stage of labor. When her membrane ruptures, the nurse's first action should be notify the physician, measure the amniotic amount of amniotic fluid, count the fetal heart rate, perform the vaginal examination. The correct answer is count the fetal heart rate to find out if there is any fetal tachycardia, if there is any cord prolapse or cord compression. The woman is placed in the external fetal monitoring. The nurse noticed that the fetal heart rate is erratic during the contraction but returns to the baseline at the end of each contraction. This is recorded as the early deceleration, variable deceleration, late deceleration, and fetal distress. The correct answer is variable deceleration. On the second postpartum day, the nurse expects the mother's vaginal bleeding to be red and moderate, red with clots, scant and brown, thin and white. The correct answer is red and moderate. What is the best indication of the breastfeed baby is digesting the milk properly? Does not experience any abdominal colic. Baby passes dark green spasty stool. Baby sleeps for several hours after feeding. Baby passes soft golden yellow stools. The correct answer is baby passes soft golden yellow stools. The first degree perineal tear include fourchette only, fourchette and the superficial perineal muscle, fourchette and the anal sphincter, fourchette and the rectal mucosa. The correct answer is fourchette only. The acute polyhydramnios occurs in 20 to 24 weeks, 26 to 30 weeks, 24, 28 weeks, 28, 32 weeks. The correct answer is 26 to 30 weeks. In female, evaluation of all pelvic organs of reproduction accomplished by biopsy, cystoscopy, Culdoscopy, hysterosalpingogram. The correct answer is hysterosalpingogram. Braxton Hicks contraction starts 8th week of gestation, 10th week of gestation, 4th week of gestation, 16th week. Correct answer is the 16th week onwards. In which of the following recognizes a teratogen? Dental X-ray, rubella, diabetes mellitus, scarlet fever. The correct answer is rubella. Increased salivation is termed as spica, thylism, operculum, none of the above. The correct answer is thylism. The diagonal conjugate is measured from upper border of the symphysis pubis to the center of sacral promontory, lower border of symphysis pubis to the center of sacral promontory, upper border of symphysis pubis to the lower part of sacral promontory. None of the above. The correct answer is from the lower border of symphysis pubis to the center of sacral promontory. The diagnostic test used to evaluate fertility is the postcoital test, and the birth time is 1 week after ovulation, immediately after the menses, just prior to the next menstrual period, within 1 to 2 days of the presumed ovulation. The correct answer is within 1 to 2 days of presumed ovulation. In high concentration of estrogen in the blood, it causes ovulation, stimulates lactation, inhibits the FSH, is one of the causes of osteoporosis. The correct answer is it inhibits secretion of FSH. A test commonly used to determine the number and motility and activity of the sperm is the Rubin test, Hunter's test, Friedman test, Papin-Colt test. The correct answer is Hunter's test. Most spontaneous abortion caused by physical trauma, unresolved stress, congenital defect, germ plasma defect. The correct answer is germ plasma defect. The outermost membrane that helps to form placenta is amnion, chorion, yolk sac, allantosis. It is the combination of the allantosis plus chorion. The pelvis, which regard as the true female pelvis, is gynecoid, anthropoid, platyploid, android. The correct answer is gynecoid pelvis. The strongest joint in the body is sacrotuberous joint, symphysis pubic, sacroiliac, sacrococcygeal. Symphysis pubis. The narrowest diameter of the pelvis is oblique diameter, antero-posterior diameter, transverse diameter, and posterior diameter. The correct answer is transverse diameter. The small rudimentary organ corresponding to the male penis is vestibule, mons pubis, Bartholin's gland, clitoris. Answer is clitoris. The anatomical conjugate measures 12 cm, 11, 13, and 10 cm. The correct answer is 12 cm. The obstetrical conjugate measures 13, 14, 11, 12. The correct answer is 11 cm. The amount of sperm present in the seminal fluid is normally 10 million, 200 million, 100 million, 200 million, 300 million, and 150 million. The correct answer is 100 million per ml. Progesterone is normally secreted in large quantities by endometrium, pituitary gland, adrenal gland, and corpus luteum. The correct answer is corpus luteum. The most frequent side effect associated with intrauterine contraceptive devices: ectopic pregnancy, expulsion of the uterus, rupture of the uterus, excessive menstrual flow. The correct answer is excessive menstrual flow. The name given to the endometrium of the uterus during pregnancy is known as myometrium, decidua, corpus luteum, none of the above. The correct answer is decidua. The layer of cells responsible for the production of HCG include cytotrophoblast, trophoblast, syncytia trophoblast, and mesoderm. The correct answer is syncytia trophoblast. The fetal blood vessel, the oxygen content is highest in the umbilical artery, ductus venosus, pulmonary artery, ductus arteriosus. The correct answer is ductus venosus. In saline method of elective abortion, the nurse should alert for the side effects such as edema, oliguria, headache, bradycardia. The correct answer is headache. Antero-posterior diameter of birth canal is one of the most important measurements of the pelvis and is known as conjugate vera, diagonal conjugate, transverse diameter, transverse conjugate. It is the diagonal conjugate. The early pregnancy, urine containing prolactin, estrogen, luteinizing hormone, chorionic gonadotropin. The correct answer is human chorionic gonadotropin. The normal cardiopulmonary system symptom experienced by a pregnant woman is tachycardia, dyspnea at birth, at rest, progressive dependent edema, shortness of breath on exertion. The correct answer is shortness of breath on exertion. The uterus rises out of the pelvis and becomes the abdominal organ at about 10th week, 8th week, 12th week, and 18th week. The correct answer is the 12th week of pregnancy. The inner membrane that provides fluid medium for the embryo is funis, chorion, amnion, yolk sac. The correct answer is amnion. The size of the ovum is almost 0.15 mm, 0.25 mm, 0.20 mm, 0.05 mm. The correct answer is 0.15 mm. The fertilized ovum is known as embryo, zygote, fetus, and gamete. The correct answer is zygote. The purplish discoloration of vaginal mucosa in pregnancy is called as Ladin sign, Hegar sign, Goodell sign, Chadwick sign. The correct answer is Chadwick sign. In prenatal development, the growth is more rapid in the first trimester, second trimester, third trimester, and the implantation period. It is in the second trimester. The polyhydramnios occur when total amount of amniotic fluid exceeds 1500 ml, 1200 ml, 1600 ml, and 1000 ml. The correct answer is 1600 ml. During the labor, +1 station indicate that the presenting part is on the perineum, high in the false pelvis, slightly below the ischial spine, slightly above the ischial spine. The correct answer is slightly below the ischial spine. During the period of induction of labor, the client should be carefully observed for the signs of severe pain, uterine atony, hypoglycemia, prolapse of the umbilical cord. The correct answer is uterine atony. Episiotomy is performed during delivery. This is most common due to stretch the perineum, limit the postpartum discomfort, reduce the trauma to the fetus, prevent lacerations during birth. It is to prevent the lacerations during birth. The umbilical cord consists of one artery, one vein, two veins and one artery and two veins, two artery and one vein. The correct answer is one artery and two vein. The pituitary hormone that stimulates the secretion of milk from mammary gland is prolactin, oxytocin, estrogen, and progesterone. The correct answer is prolactin. The length of the average length of the cord is 40 centimeter, 50, 60, 55. The correct answer is around 50 centimeter. After the just 3 months of pregnancy, the chief source of estrogen progesterone is placenta, adrenal cortex, corpus luteum, anterior hypophysis. The correct answer is at placenta. The ovulation occurs when oxytocin is high, blood level of LH is high, progesterone level is high, endometrium is slugged off. The correct answer is blood level of LH is high. After ovulation has occurred, the ovaries remain viable for 1 to 2 days, 12 to 18 days, 24 to 36 days, 48 to 72 days. Among the choice, the answer is 1 to 2 days, but the lifespan of the ovum is 12 hours to 24 hours. The largest part of weight gain during pregnancy is due to the fetus, the fluid retention, fluid alteration, increased blood volume. The correct answer is the fetus. The client who is 10th week pregnant complains of morning sickness. To promote relief, the nurse should suggest eating dry candy before arising, increasing her fat intake before bedtime, having 2 small meals daily and snack at noon, drinking more carbohydrate fluid with her meal. Correct answer is eating dry candy before rising. The anterior frenella, otherwise known as lambda, brecma, vertex, and vault. The correct answer is brecma. The fetal skull in the biplateral diameter measures 10.5 cm, 9.5 cm, 10 cm, and 11.5 cm. The correct answer is 9.5 cm. The breastfeeding always contraindicated in case of mastitis, pregnancy, inverted nipples, and herpes genitalis. Correct answer is pregnancy. Because the pregnancy, if you breastfeed, it may cause oxytocin induction, stimulate the nipples, so it may cause oxytocin induction and may end up in abortion. Amniotic fluid appears normal if it is clean and dark amber color, milky greenish yellow, clear colorless, containing little white specks, cloudy greenish yellow. Correct answer is clear, colorless, containing little white specks. The fetal blood need with the fetal need for iron greatest in the last 4 weeks, last 6 weeks, last 8 weeks, and 10 weeks of pregnancy. The correct answer is last 8 weeks of pregnancy. Leukorrhea in the pregnancy is caused by increased metabolic rate, production of estrogen, functioning of Bartholin's gland, supply of sodium chloride to the cells of vagina. The correct answer is product because of the production of estrogen. Thank you for listening. If you have any comment, any suggestions, please let me know.